So our next question is, which statement is not true regarding Crohn's disease, right? So they are basically asking about the false statement regarding the Crohn's disease. Now the options are, the option A is the rectum that is not involved. Option B, it is continuous lesion that visualized in the endoscopy. And option C is the non-caseating granuloma that has been seen, and the option D is the cobblestone appearance, right? Okay. So let's see few concepts regarding the Crohn's disease. So regarding the Crohn's disease, it basically an chronic inflammatory bowel disease. So your chronic inflammatory bowel disease, it is basically divided into two types, right? So one is your ulcerative colitis and the another is your Crohn's disease. So here what happens is that there is a inflammation of the GI tract that happens. So typically, with a Crohn's disease, it basically affects from the any part of the GI tract and typically from the mouth to anus, right? The most common area that basically get involved in case of Crohn's disease is your terminal ileum and the colon, okay? Terminal ileum and your colon. Here you need to understand the clinical features as well. Like the patient with a Crohn's disease, they may are presented to you with abdominal pain, and the abdominal pain typically occurring in the right lower quadrant, right lower quadrant, and it basically also can mimic the appendicitis in some cases. But obviously the patient with such condition may associated with a chronic diarrhea. It may be bloody diarrhea or a non-bloody as well. But obviously, you might able to get the history of chronic weight loss, and there is a chronic low-grade fever and the malaise in the patient. And in case of children, obviously, you are able to encounter there is a growth retardation in case of Crohn's disease with a children. Now, in case of Crohn's disease, what exactly happens in that there is a perianal disease. Okay, so the perianal disease is basically pretty much specific for the Crohn's disease, which we not readily encountered in case of ulcerative colitis in that case. And here they typically present with the skin tags. Sometimes there is a fissure, also there is a abscess and fistulas as well. Now, regarding the Crohn's disease, there is a endoscopic appearance. So there is a cobblestone mucosa that has been seen. Look, what happens in case of Crohn's disease, there is a transmural involvement, means the entire thickness of the intestine that basically gets involved, right? Where in case of ulcerative colitis, it's typically involved only the mucosal area. Now here, as a result of that, so there is a linear ulcer that basically develops, and this linear ulcer eventually gives rise to this cobblestone like intestinal surface. So you can able to appreciate that in this image. So there is a diagram that basically shows that there is a cobblestone like appearance of the intestinal surface, and it basically happens due to number one, there is a mucosal edema is there, and the number two is that there is a linear ulcer that basically gives us such appearance. Also there is a aphthous ulcer. So this aphthous ulcer are nothing but they are only the deep longitudinal fissures only, okay. Also there is a thickened bowel wall, and that thickened bowel wall leads to development of the narrowed lumen as well. And typically you are able to appreciate there is a fat creeping. So this fat creeping is basically the mesenteric fat that basically wraps up around the bowel, right? So there is a excessive mesenteric fat that is basically seen in such patient, and they are typically seen to be wrapped around the bowel in such cases, okay. This is your fat creeping for you. So you can see that in this image, right? So this is the fat creeping as well. One thing that also need to be understand, the fissure, like in case as there is a transmural involvement in case of Crohn's disease has been seen, means the entire thickness of the intestine getting involved in this inflammatory process. So that will eventually leads to development of the fistula and sometimes the fissure as well, okay. So this fistula, maybe there is a like a ileocolic or sometime ileo-ileal, or in between the small intestine, or sometimes intercutaneous or interatmospheric fistulas also has been seen in such cases. Okay. Also, the patient with a Crohn's disease, they may comes to you with the features of the stricture. Also, there is a features of the obstruction that may be seen, and this things basically happens as a result of the fibrosis. So as there is a long standing process of the inflammation is there in the intestine, so as a result of this, it may produce fibrotic stricture, and that fibrotic stricture may leads to development of the obstruction. So most of the time you might able to encounter like the subacute, the patient with a Crohn's disease, they may present to the emergency department with a subacute intestinal obstruction, right? So this kind of scenarios has been seen multiple times. Now you need to understand the histological features. Obviously, there has been lots of histological based question has been given. So you need to understand, or you need to identify these questions as well. So obviously you can able to understand there is a crypt abscess is there, right? So in this image you can able to appreciate that there is a crypt abscess is there, right? So this one is the crypt abscess. So as a result of this, obviously there is a distortion of the crypt also has been encountered, right, here as well. Also, as a result of this, there is a transmural inflammation. So you can see that this entire thickness of the intestine is getting involved. Also, there is a presence of non-caseating granulomas will be seen. Non-caseating granulomas will be seen. So number one, there is a transmural inflammation, there is a lymphoid aggregate, there is a non-caseating granuloma, and also there is a crypt distortion, and there is a architectural irregularities that will be seen in case of Crohn's disease. Now we need to understand what are the diagnostic findings we are able to encounter. So here in case of Crohn's disease, number one is the colonoscopy. So regarding the colonoscopy, the most important things regarding the Crohn's disease, they basically shows an skip lesion. Okay, and so this is important point regarding the Crohn's disease. Also, as I have already mentioned, so there is a cobblestone appearance and the aphthous ulcer can be seen, but the skip lesion is basically pretty much specific for the Crohn's. Also, you can go for the biopsy, and obviously in the biopsy you are able to encounter the histological features that have been mentioned earlier, right? So in the imaging, obviously you have your CT enterography, MR enterography, and the a barium study is there. So typically in case of barium study, we are able to encounter there is a string sign of the Cantor, right? So you can able to appreciate that. So there is a proximal intestinal shadow is there, and obviously then there is a string like appearance of this shadow, right? And then it basically reappears again. So the whole structure basically gives us a appearance of string like sign, like, so it is basically known as the string sign of Cantor. Okay. Now regarding the string sign of Cantor, obviously in the CT and MR enterography there is a bowel wall thickness, as I have already mentioned, and obviously you can also able to encounter there is a fistula and the abscess formation that can also be seen in such cases. And in the blood test or in the biochemical test, obviously there is a raised ESR CRP as a result of the chronic inflammation. There is a anemia and the hypoalbuminemia as a result of the chronic inflammatory process as well. And there is a anti-Saccharomyces cerevisiae antibodies. They may be found to be positive in patients. Okay, so let's see regarding the differentiating features between the Crohn's disease and the ulcerative colitis. So look, in case of Crohn's disease, as I have mentioned, so it can involve from the mouth to anus anywhere, but typically the most common site is your terminal ileum specifically. But in case of ulcerative colitis, obviously from the name colitis, it basically suggests mostly involves the large intestine, typically the colon and rectum only. In case of Crohn's, they basically shows a skip lesion, which is pretty much characteristics of the Crohn's lesion. But in case of ulcerative colitis, they are seen to be with a continuous lesion. Okay. So in case of Crohn's, there is a transmural involvement is there, but here in case of ulcerative colitis, only the mucosa and the submucosa only get involved. But so in case of Crohn's disease, obviously we are able to encounter the skip lesion as I have already mentioned. But obviously, in case of ulcerative colitis, there is a continuous lesion that is there. But regarding the depth of the involvement, the Crohn's basically and transmural involvement is there. But in case of ulcerative colitis, only mucosa and the submucosa only get involved. In case of Crohn's, rectum often gets spared. But here, in case of ulcerative colitis, the rectum is always involved in such cases. In case of Crohn's, there is a non-caseating granuloma. We have already seen how does it looks in the histopathological examination. But in case of ulcerative colitis, this granulomas remain absent. Okay, but the fistulas are pretty much common in case of Crohn's disease, but in case of ulcerative colitis, they are pretty much rare. Surgery is basically not curative for Crohn's disease. But here in case of ulcerative colitis, we can easily go with a colectomy in such cases. So there is a one interesting mnemonics is there, which is known as the corn sister. So your corn means Crohn's disease, and the sister is the mnemonic. So S for skip lesion, I for the ileum, which is the most common affected site. There is a Saccharomyces cerevisiae antibody that is present in here. Also, there is a transmural involvement, and E for extra fibrosis and the fistula, right? Extra fibrosis and the fistula formation compared to that of the ulcerative colitis. And the R for the radiological sign, there is a string sign of Cantor, and the rectum that basically usually gets spared. Look, this topic, this the ulcerative colitis and the Crohn's disease. This is basically examiners one of the hot favorite topic. One must understand how to treat such patients, and how to differentiate the diagnostic features, and what are the differences are there. You must need to learn. Okay, it's a very much important question every year. At least one question they ask from this topic. Okay, so let's go to the question again, right? So now, which statement is not true or which statement is false regarding the Crohn's disease? So your option A, rectum is not involved. Yes, rectum usually gets spared. So this is the true statement. Then it is basically the continuous lesion that visualized in the endoscopy. Is it so? No, it's basically the skip lesion, right? It's basically the skip lesion. So this is an false statement. This is a false statement. Then comes your non-caseating granuloma, right? So in case of non-caseating granuloma, yes, it has been seen with a Crohn's disease. It's a true statement. And the cobblestone appearance, again, it is the true statement that we are able to encounter in endoscopy. Okay. So here is the answer is option B, right? Option B is our answer.